Ovarian cancer is a formidable health challenge that arises from the ovaries, often going undetected until it has spread within the pelvis and abdomen. At its early stages, it rarely presents clear symptoms, but as the disease advances, it may cause signs such as abdominal bloating, pelvic pain, and changes in bowel habits. Women may also experience frequent urination, fatigue, and unexplained weight changes, which could be easily mistaken for less serious conditions. Treatment options typically include a combination of surgery and chemotherapy, with the aim of removing as much of the tumor as possible and destroying any remaining cancer cells. Factors that can increase the risk of ovarian cancer include age, genetics, a personal or family history of cancer, and certain inherited gene mutations like BRCA1 and BR2. Here's a detailed exploration of the intricacies and impacts of ovarian cancer. Symptoms and progression of ovarian cancer. Ovarian cancer, often dubbed the silent killer, can progress stealthily, with symptoms easily mistaken for less serious conditions such as digestive or menstrual disorders. Early signs might include abdominal bloating, pelvic discomfort, feeling full rapidly, or frequent urination. As the disease progresses, these symptoms can become more pronounced, with the addition of factors like unexplained weight loss, fatigue, or changes in bowel habits. Unfortunately, due to the vagueness of early symptoms, ovarian cancer is frequently diagnosed at a later stage when the malignancy has spread, making intervention more complex. Recognition of symptom patterns and early detection through medical imaging and blood tests, like the CA-125, can improve outcomes, emphasizing the crucial need for vigilance and prompt investigation by healthcare professionals. Diagnosis of ovarian cancer. The diagnosis of ovarian cancer can be particularly challenging due to its subtle early symptoms, which often mimic those of less serious conditions. Often termed a silent killer, ovarian cancer may not be detected until it has progressed to an advanced stage. Early detection significantly improves survival rates, but there is currently no effective screening test equivalent to mammography for breast cancer. Diagnosis typically involves a combination of pelvic examination, imaging tests like transvaginal ultrasound or CT scans, and blood tests for tumor markers like CA-125. However, elevated CA-125 levels aren't specific to ovarian cancer and can occur in other conditions. A definitive diagnosis typically requires a surgical biopsy, with pathology confirming the presence of cancer cells. This complex diagnostic process underscores the need for increased awareness and improved screening methods to catch the disease in its nascent stages. Cause and risk factor of ovarian cancer. Ovarian cancer, a complex malignancy of the ovaries, often arises with little to no warning symptoms. Its precise cause remains elusive, but research recognizes a myriad of risk factors that can elevate the risk of developing this condition. Genetics plays a significant role, with mutations in the BRCA1 and BR2 genes drastically increasing susceptibility. Additional genetic syndromes like Lynch syndrome also heighten risk. Hormonal influences, particularly long-term estrogen exposure and infertility, have been implicated, while reproductive history, like never having been pregnant, can similarly impact risk levels. Lifestyle factors such as obesity and smoking can contribute, although the link is less definitive compared to breast or lung cancers. Awareness of these risk factors is crucial for early detection and prevention strategies, as ovarian cancer typically goes undetected until it reaches advanced stages. Treatment and management of ovarian cancer. In treating ovarian cancer, the approach is often multifaceted, combining surgery with chemotherapy to manage the disease effectively. Surgery aims to remove as much of the tumor as possible, a procedure known as debulking, followed by chemotherapy to target any remaining cancerous cells. Intraperitoneal chemotherapy, where drugs are delivered directly into the abdominal cavity, can be particularly effective. In advanced stages, targeted therapies may be used, focusing on the cancer's specific genes and proteins to inhibit its growth. Recently, PARP inhibitors have shown promise in treating ovarian cancer, especially for those with BRCA mutations. Regular follow-ups are crucial, as ovarian cancer often recurs, and ongoing research continues to refine these treatments and explore new avenues like immunotherapy.